Hello, everyone. Good afternoon, and thank you for coming to this Board of Animal Health Quarter 3 webinar. I think we're going to get started. We still have a number of people joining, but I think it is 12:03, so we'll go ahead and get started. Today, our speaker will be presenting about rabies in Indiana. My name is Dr. Caitlin Macy, and I'm the District 9 Field Veterinarian with the Board of Animal Health, and I will be the moderator for today's webinar. Today's speaker is Dr. Melissa Justice. Dr. Justice earned a bachelor's degree in animal science from Purdue University in 1994 and graduated from Purdue's College of Veterinary Medicine in 1998. She worked in small animal general practice and a small animal emergency practice until she joined the Indiana State Board of Animal Health in 2007. She has served as the District 6 field veterinarian for BOA since that time. Her day-to-day duties involve animal welfare investigations, emergency preparedness, disease traceability, and public health. Dr. Justice is the director of BOA's small animal health, rabies, and brucellosis programs. Just a couple of housekeeping items before we begin. We will have a Q&A session at the end of Dr. Justice's talk. You are muted today. If you think of questions during the presentation, please feel free to type them into the chat box and we'll try to address as many as we can. You can direct them either to BOA or to everyone in the chat section. Additionally, you are able to receive continuing education credit for this webinar. If you have signed in on Teams with your name, we will send your certificate to your email address that you signed in with. If you called in, please email us to let us know that you have joined, and we will also send you your certificate. So with that, please take it away, Dr. Justice.
Thanks, Kate. I want to thank everybody for joining us today for this Lunch and Learn session. This afternoon, we're going to be talking about rabies virus, and I'm hoping to highlight some information which I feel like is particularly important for veterinarians and their staff to understand and remember, just to kind of make it easier for you in your day-to-day clinical lives. So I want to start today by briefly reviewing some information about the virus and how it moves through the body so that we can make sure that we're really all on the same page. Rabies is a neurotropic virus, which means it has an affinity for the neurologic tissues of the body. And this is really important to understand and remember because it means that the virus doesn't move through the body via the bloodstream like a lot of the other viruses that we have in veterinary medicine that we deal with. Rather, it moves from the site of exposure or the bite wound to the brain via the nervous system. And this is a much slower process. So as a result, the disease has a long incubation period of anywhere between 3 weeks and 12 weeks generally. The virus is essentially 100% fatal once clinical signs are noted. So people who have been exposed or may have been exposed will feel an extreme sense of urgency to do something right now. And they're often hesitant to wait for the end of the 10-day post-bite exposure period to get the answers they need to make the medical decisions. And a lot of times they just want to run right out and get the post-exposure prophylaxis right away. And I understand their urgency and I empathize with them, but I also understand that we have the luxury of time with this disease before we are forced to make medical decisions for post-exposure care for the animals or for the people that may have been exposed. The great news is that the human post-exposure prophylaxis is almost always curative if it's administered prior to the onset of clinical signs. And I say almost always because, of course, there always has to be a single outlier. There was a single case of a vaccine failure in the United States, which occurred in 2021. And this was a case of an 84-year-old Minnesota man who died after receiving properly administered post-exposure prophylaxis. And it was later found out that he had an undiagnosed immune deficiency, which was likely the cause of the treatment failure. This was the first documented case of post-exposure prophylaxis failure in the United States. So it's essentially 100% fatal, or excuse me, 100% effective at preventing disease when the post-exposure prophylaxis is administered properly according to the schedule and prior to the onset of clinical signs. So all mammals are susceptible to rabies, but not all mammals are considered to be important sources of disease or reservoirs for human or domestic infection. The animals that are considered to be important reservoirs or high-risk species for infection are the bat, the fox, the raccoon, and the skunk. We often get calls at our office asking if we need to be worried about small prey species such as squirrels, mice, hamsters, guinea pigs, things like that. People want to know if they need to submit those animals for testing after they've had a human bite exposure. And while the small prey animals are susceptible to rabies virus, we don't really consider them to be a significant source of rabies for human infection or animal infection following an interaction. It's most likely that these animals are going to die as a result of the infection before they're ever capable of transmitting the disease. But with that being said, any mammal that is showing neurologic clinical signs and potentially exposes a human or an animal to rabies needs to be euthanized and tested at the state lab, including all of those small prey animals. So the bottom line is, if they're neurologic and they exposed a human or an animal, it doesn't matter whether they're high risk or not. We need to be submitting those animals. And we'll talk a little bit more about that later. Transmission of rabies virus occurs through direct contact with the saliva or nervous tissue from an infected animal. And here in Indiana, our primary reservoir for rabies infection is the bat. Our state lab tests anywhere between 450 and 500 bats each and every year. And usually out of those submissions, 10 to 20 of those samples will end up being positive for rabies. So this equates to a prevalence of rabies in our bat population somewhere between 1% and 3%. And keep in mind that most of the bats that are submitted have had some sort of an interaction either with a human or an animal, which resulted in them being euthanized and submitted to the lab. I also want to point out that it's possible for a single bat in a colony to be infected. And this is important because if someone has a colony in their home and a single bat is found to be positive, a lot of times they want to eliminate or euthanize the entire colony of bats. And that's not necessary because bats don't have behaviors that typically transmit the virus throughout the entire colony. What we should be recommending in those situations is that they work with a bat removal company or a mitigation company to exclude the animals from their home so that they don't come back in. The second important reservoir for infection in Indiana is the skunk. And the last time we had a positive skunk here in Indiana was in 2004, so 20 years ago. And coincidentally, this is the last time we had a terrestrial rabies reservoir in Indiana as well. Unfortunately, this year, there have been 4 rabies positive skunks, which have been identified in Clark and Washington County, indicated by the blue highlight on the map that's on the screen. And so far this year, we've had 4 cases of rabies positive skunks in southern Indiana. And it's really not a big surprise that we found rabies positive skunks because our neighbors to the south in Kentucky are known to have rabies in their skunk population. I think we had just kind of hoped that the Ohio River might serve as a natural barrier to limit the movement of infection into our state. But unfortunately, that hasn't been the case so far this year. Right now, we don't necessarily know what the prevalence of rabies positive animals is in our skunk population here in Indiana. The Department of Natural Resources, the Indiana Department of Health, and the Board of Animal Health are working to perform enhanced surveillance in 4 southern Indiana counties, including Clark County and Washington County. And we're utilizing a lateral flow assay test, which is currently being validated for use by the CDC. And this is a test that can be performed in the field for the surveillance of animals which have not had a known exposure to a human or an animal. And this is important because we want to be able to conduct surveillance, but we don't want to add to the burden that's already existing at our state rabies lab and potentially delay results for a sample that had a human exposure associated with it. So being able to perform these tests in the field is really important. So the type of animals that we are conducting surveillance on and using this test for are animals which are exhibiting abnormal behavior but have not had an interaction with a human or an animal, or they're found dead on the roadways. And if any of those tests end up being positive on the lateral flow assay test, then those tests will be confirmed either by the Department of Health Rabies Laboratory or the CDC. This map shows all of the terrestrial reservoirs for rabies infection throughout the United States. And I say it's terrestrial. So these are the land-based reservoirs for rabies infection throughout the US. Bat rabies is present and prevalent throughout the entire continental US, so it's not indicated on this map. So on the East Coast, the green color indicates rabies or raccoon rabies as their terrestrial reservoir for infection. The light blue and the yellow is the skunk reservoir in the Midwest. New Mexico and Arizona have both skunk rabies and fox rabies as their terrestrial reservoir. California has skunk rabies. Alaska's main terrestrial reservoir is the Arctic fox, and Puerto Rico's main terrestrial reservoir is the mongoose. And I wanted to point out the various different reservoirs of infection throughout the US because I know that each of us send and receive animals throughout the United States. And I think it's important to understand that each state is going to have different rabies quarantine procedures for their domestic animals, as well as different vaccination rules when compared to Indiana, because they're facing different reservoirs of infection from us. And like I said, up until this year, we only had bat rabies as our primary reservoir. We didn't have skunk rabies until this year. So it made us interpret things a little bit differently than, say, something on the East Coast where they're frequently faced with raccoon rabies. Despite all the terrestrial vectors that we have here in the US for rabies, we're really, really fortunate that we don't have or that our domestic animals don't serve as a common source of infection. In the US, we don't typically see human deaths as a result of rabies virus infection. You can see in this table, we usually have between 0 and 3 human cases each year. And this is not the case throughout the rest of the world. Outside of the US, it is estimated that 59,000 people die each year as a result of rabies virus infection. And I will repeat that statistic because I use it often. I think that here in the United States, and especially in Indiana, we have kind of a passive view of rabies. We think, it's not really a disease that we face often. We vaccinate for it in practice, and we've got a good handle on it. But that's certainly not the case in the rest of the world. Almost 60,000 people are dying each and every year as a result of rabies virus infection. So, just keep that in mind. 99% of those cases are occurring as a result of an exposure to an infected dog, and at least half of those deaths are in children under the age of 15. Versus here in the United States, our main source of infection is due to exposure to a bat or wildlife or international travel. And I included this slide to emphasize that rabies is not a disease of the past. We are just extremely fortunate to be living in a country where dogs don't have rabies, our cats don't have rabies, and we have ready access to post-exposure prophylaxis. And like I said, this isn't the case worldwide. And I think it's important to point out because we've all seen the recent changes to the CDC rules for the importations of dog from outside of the US and in particular high-risk rabies countries. And we understand here at BOA that this is a huge pain to learn the new processes and make sure that you're getting all of the certificates that animals need to travel in a timely manner. But I want you to understand that these rules are established as a direct result of 4 rabies positive dogs, which were imported into the United States as part of the rescue process between the years of 2018 and 2021. Those dogs were imported directly from high-risk countries and were found to have fraudulent vaccination certificates. And so what I mean by this is either the veterinarian who endorsed the rabies certificate lied and that animal wasn't vaccinated, or what happened more often was that they were using a partial dose of rabies vaccine to inoculate those animals. And in a lot of cases, we found that they were using a quarter dose of rabies vaccine, thinking that they could spread their supply out over more animals. But unfortunately, that quarter dose did not impart immunity for those dogs, and they ended up being positive once they got to the United States. So as a result of those imported dogs, there were multiple humans that had been exposed during the rescue process and then had to be treated with post-exposure prophylaxis. And I think this is important because, again, in the United States, we have ready access to post-exposure. And I think we just assume that it's going to be there when we need it, but we don't think about the implications of it. Post-exposure prophylaxis is extremely expensive. I've heard figures that range anywhere between $4,000 to $5,000 for the series, all the way up to $20,000 for the series. And it may or may not be covered by insurance. So, we need to try to be doing things to prevent this from happening in the US. When I first joined the Board of Animal Health, I attended a lecture that was being given by our state public health veterinarian. And during her presentation, she explained the path of rabies virus in the body. And this explanation really resonated with me. So I want to briefly share that information with you and explain how it determines the quarantine period for an animal following an exposure. So in this diagram, we're going to follow the little red splotch, which is the rabies virus. And as you can see, it starts out in the salivary gland of the infected animal. The virus is introduced either through a bite wound, salivary contact with the mucous membrane or a break in the skin, or through a direct exposure to neurologic tissue of an infected animal. The virus then moves from the site of introduction or the bite wound into the muscle tissue where it replicates. It moves into the peripheral nerve tissue and begins to move up towards the spine. Once it's in the spinal cord, the virus then moves up towards the brain. And this movement from the site of infection or the bite wound to the brain is slow. And remember, I said it can take anywhere between 3 weeks and 12 weeks. The variation in the incubation time is really dependent on the proximity of the injury to the brain, the concentration of virus that's present in the saliva, and then the immune system of the bitten animal. So a bite to the face is likely to have a much shorter incubation period than a bite to the toe. And it's important to remember that before the virus reaches the brain of the animal is clinically normal. Once the virus reaches the brain, we begin to notice clinical signs such as changes in behavior and neurologic signs. And those clinical signs are rapidly progressive. So once clinical signs are noted, the animal is usually within 3 to 5 days of dying as a result of that infection. And it's only after the virus moves through the brain that it goes into the salivary gland of the infected animal. And once it reaches the salivary gland, it's now considered to be infectious to humans and other animals and is within 3 to 5 days of dying as a result of the infection. So think about how this applies to the quarantine laws in our state. When an animal is exposed or bitten, the incubation time before clinical signs is usually anywhere between 3 weeks and 12 weeks. So in these situations, when the animal is bitten, we initiate a prolonged quarantine period. When the animal bites a human, we're looking to see if the virus was present in the saliva at the time of the bite, so we utilize a short quarantine period of 10 days. And I've tried to summarize the two different types of animal rabies quarantines on this slide because I think this is one of the most confusing things for people in the industry to kind of remember. On the left side of the slide, we have animals which have bitten either a human or a domestic animal, and those animals are going to be quarantined and observed for a period of 10 days post-bite. On the right side of the screen, we have animals that have been potentially exposed to rabies. And this is where we look at the vaccine status of the animal to determine if they're going to need either a 45-day quarantine or a 4 to 6 month quarantine. So let's start by looking at the 10-day post-bite quarantine and talk about what happens when an animal bites a human. So whenever an animal bites a human, we need to perform a risk assessment. And we need to ask ourselves two questions. Did sufficient contact occur to allow the transmission of rabies? And was the animal rabid? So how do we know if sufficient contact occurred to allow the transmission of the virus? Well, transmission can occur in one of three ways. We either have a direct bite exposure, a non-bite exposure, or a bad exposure. And the most obvious way that an exposure occurs is through a bite wound, which is any penetration of the skin by an animal's teeth. However, we get a lot of calls asking what happens if an animal bit someone, but they didn't break the skin. And so in these situations, I'll typically ask if there's a possibility that the animal's saliva entered the body either through a break in the skin or through the mucous membranes. And if we can't rule this out, then we have to consider that to be a non-bite exposure and start thinking about what happens next. When bats are involved, it's important to remember that bat bites are extremely small, as you can see in this photo. This is a bite of a big brown bat circled in white, and this bite happened earlier in the day. And all you can really see of the bite is that there's two really tiny red marks where the teeth entered the skin. And so realistically, it is highly unlikely that we would ever find a bite just by looking at a patient, whether it be a human patient or an animal patient. So whenever direct contact with a bat occurs or a bat is found in the same room with a sleeping individual, a person who is impaired by drugs or alcohol, a person with an intellectual disability, or an unattended child, we have to consider these situations to be sufficient exposure and move on to the next question. The next step is to determine if the animal was rabid at the time of the bite. So if the animal's available, it is our duty to take steps necessary to rule out rabies. And this is honestly essential to help make decisions for post-exposure care of the human, determining whether they need to go through post-exposure prophylaxis, or if an animal was bitten, it's important for us to understand the rabies status of the biting animal so we know whether we need a prolonged quarantine or not. So whenever an animal bites a human, we only have two options. We quarantine and observe the animal for 10 days, or we euthanize and submit the animal for testing. For dogs, cats, and ferrets, the preferred method of ruling out rabies is through the 10-day post-bite quarantine. If the animal can't be quarantined because it would be too inhumane, either the animal is too injured or too ill to be made to stay alive for 10 days, or if it would be unsafe because the animal is too aggressive to safely contain, then that animal can be euthanized and submitted for testing. But this needs to be the exception to the rule. We really need to be taking advantage of the opportunity to do a 10-day post-bite quarantine when we're dealing with dogs, cats, and ferrets. There is no approved quarantine period for bats or wild animals, so the only way to rule out rabies in those species is through euthanasia and testing. This is an important slide. The vaccination status of the biting animal does not affect our decision-making process when a domestic animal has bitten a human. In this situation, we only have two options: the 10-day quarantine and observation of the animal, or the euthanasia and submission of the animal for testing. And I think this is important because, we all know that there are situations that occur. We have a fully vaccinated animal that we're euthanizing for humane reasons, and it accidentally bites someone during the process. And I get a lot of calls of people saying, but the animal was fully vaccinated. Do we still have to submit the head? And unfortunately, the only way to prove that the animal didn't have rabies at the time of the bite is to look at either the 10-day quarantine and observation period, or to euthanize and submit the head for testing. So during this 10-day post-bite period, we're basically observing the animal to determine if it was capable of transmitting the virus at the time of the human exposure. The animal can be confined at the owner's home, a veterinary facility, or an animal control facility, whatever makes the most sense. And if clinical signs are noted during this time, the animal should be evaluated by a veterinarian. And I like to always remind people that there are a lot of things that can cause an animal to have clinical signs beyond rabies. So I never want people to be afraid to bring their animal in and have it evaluated during their quarantine period. We are not going to force them to euthanize the animal. We are not going to force them to do something, but there may be something that you as a veterinarian or veterinary staff can help them with. And so I think it's important to encourage them to touch base with you if something happens during that quarantine time. If the animal's alive at the end of the 10-day period, it didn't have rabies, the human's okay, and we can move forward with our life. At this point in time, if the animal is overdue or unvaccinated, then you can go ahead and update the rabies vaccine of the animal if it's needed. Whenever a veterinarian is made aware of an animal bite to a human, we are required by Indiana law to file a bite report with the local health department. And these report forms can be found on the Indiana Rabies information page, which is www.in.gov/rabies, or if you Google Rabies Indiana, it'll pop up as well and bring you to this site. But if you click on the link for reporting animal bites, which I have circled in yellow, you will go to the current link, which provides access to a PDF download that can be submitted directly to your local health department. In the future, the Department of Health is working for an online form that can be submitted directly to your local health department with the click of a button, but it's still in the testing phase right now. When you're filling out this form, you want to make sure and provide as much information as possible so that the local health department can follow up for post-exposure care of the bitten individual and help assist with any animal quarantines that need to be done. These forms only need to be filled out when a human is bitten. You don't have to fill this form out for an animal versus animal interaction. And the good news is if the bitten individual is planning to seek care by a physician, an emergency room, or an urgent care facility, then they are responsible for filling the bite report out and filing it with the local health department. So that alleviates us of that duty. So I want to switch gears now a little bit and move on to what we do when an animal bites another animal. And we're going to start by talking about how we handle the biting animal whenever an animal versus animal interaction occurs. So keep in mind, this is handling the biter. If the biter is a dog, cat, or ferret, we observe the animal for clinical signs consistent with rabies for a period of 10 days. And remember, the vaccination status of the animal does not affect how we respond when an animal is the biter. We're observing to see if the animal was capable of transmitting rabies virus via the saliva at the time of the bite. So if the animal's alive at the end of the 10-day period, it didn't have rabies. And we aren't trying to protect the biting dog from getting rabies. So we're going to wait to update any overdue rabies vaccinations until after the observation period is over. And hopefully this will help us avoid any unwanted vaccine reactions that might complicate an interpretation of clinical signs. I will clarify, though, that if this is the only time you think that you will ever see this animal and you want to update the rabies vaccine and take the chance that you're just going to have to potentially interpret a vaccination reaction, it's not prohibited for you to do so. So if you need to take advantage of having that animal in your clinic and doing something to get it updated for rabies, please feel free to do so. If the biter is one of our high-risk reservoir species, such as the bat or the skunk in Indiana, the only option to rule out rabies is to euthanize the animal and submit the tissues for testing. Off-label use of vaccination in wildlife is not recognized in Indiana, and there are no approved quarantine periods for wildlife species. So this is the best option. And I want to take this opportunity to encourage you to assist your clients in the testing process if they have a family member or an animal which has been bitten by one of these species. I know that it's a pain in the butt to have to bring these animals into your clinic. It's a pain in the butt to have to think about euthanizing them and submitting their head. But think about how it would feel if it was your family member that had been bitten, or if it was your animal that had been bitten or interacted with it. Having a negative test result can make all the difference in the world. So, if you are ever approached and asked to submit one of these animals on behalf of one of your clients, please consider doing so. So now I want to move on to discussing the treatment of care of the animal when it is the bitten animal. In this instance, we're going to move to the right side of the chart that I showed you earlier and look at the information on post-exposure quarantines. So let's start by talking about the most common scenario, which is animal versus animal interaction, and discuss how to handle situations where a domestic animal is bitten by another domestic animal or a livestock species. So this is your dog versus dog, cat versus cat, dog versus cat situations. In these situations, dogs, cats, ferrets, and livestock are considered to be low-risk exposures because we don't see those species as a common reservoir here in the United States. We don't consider them to be our highest risk, and so we think about them a little bit differently. So bitten animals which are currently vaccinated do not require a booster vaccine or observation period following a bite. Any animals which are overdue or have never been vaccinated against rabies virus should be given a current rabies vaccine and then observed for clinical signs. Whenever a domestic animal is bitten by an animal that is unknown, or if we have a rabies positive test back on the biter, we now have to look at the vaccine status of the animal to determine what the length of the quarantine period should be. If the animal is current or overdue for rabies vaccination, it should be given a booster vaccine within 96 hours of the exposure, and it will then be quarantined and observed for a period of 45 days. If the animal has never received a vaccine in its entire life, then it gets a rabies vaccination within 96 hours of the exposure and quarantined for an extended period of time, which is going to be 4 months for dogs and cats and 6 months for ferrets. So in these situations, when we're talking about the animal that is bitten, we're going to go ahead and we're going to vaccinate them before the quarantine period because we're trying to protect them. We know they've had a potential exposure. We want to do everything we possibly can to boost their immunity to give them the best chance at fighting off the virus. And so we want to vaccinate them before they go into their quarantine period. So for the post-exposure quarantine, these animals should be securely confined at the owner's property with 2 barriers of protection between it and the general public. So this can be a dog inside of a room, inside of a home. That's 2 barriers of protection. This could be a cat inside of a cage, inside of a home. There are a lot of creative solutions for this. But what we're doing is we're trying to minimize any unnecessary exposures to the public or other animals so that if this animal would happen to become positive during the quarantine period, then we've minimized the number of humans and animals which are going to require post-exposure care. Again, any illnesses that are observed during this quarantine period should be evaluated by a veterinarian, and any animals that die or are euthanized during the quarantine period must be tested for rabies. And I want to point out that if we have a known positive exposure, so if we have test results that say that the biting animal was positive and the bitten animal was completely unvaccinated, those animals are going to be quarantined and monitored by a veterinarian from our agency. We'll send a veterinarian out to the home of the owner, and they will follow through with that animal and that owner until the quarantine period has ended. So this information that I just gave you has been summarized in 2 different formats. We have the decision tree on the left, which can be found on our Indiana Rabies website for download and printing. We also have slide cards, which can be used in the clinic. And I think a lot of you have probably seen these floating around somewhere in your clinic, maybe didn't know what to do with them or don't know where they are all the time. But these can be very helpful for both human exposures and animal exposures. And if you want to request a copy of the rabies slide card, just contact our agency and we can get those sent out to you. I talked previously about submitting samples for testing to the state rabies lab, and I just want to briefly touch on this subject and give you some helpful hints for that. Any dog, cat, or ferret which can't complete the 10-day post-bite confinement period due to either humane reasons or because of aggression should be euthanized and have the head submitted to the laboratory. Any mammal that is exhibiting neurologic signs and has had a human or animal exposure should be humanely euthanized and submitted to the lab for testing. And any high-risk rabies reservoir species, so this is the bat, the fox, the raccoon, and the skunk, if they have had an interaction with a human, or if they're exhibiting unusual clinical signs of illness, they should be euthanized and tested for rabies. And I want to point out, we often get questions about the legality of euthanizing bats, since there are some of those species that are protected in Indiana. And we've touched base with the Department of Natural Resources, and their stance is if that bat has potentially exposed a human or an animal to rabies, then that individual bat is no longer protected. So in those situations, the bat needs to be humanely euthanized and submitted for testing. All samples are submitted to the Indiana Department of Health Rabies Laboratory in downtown Indianapolis. And you want to make sure that all samples are shipped for overnight delivery during normal business hours to make sure that the sample is delivered in a timely manner and in a good condition for testing. You can also have your client drive the sample down directly to the laboratory if that's something that they want to do as well. To access the submission forms online, you go to the Indiana Rabies Information website and click on the link for Animal Rabies Sample Submission, which I have circled in yellow. And this is going to lead you to the section that I have circled, which is the area to either log into the Department of Health LIMSnet system or to create an account. And I think it's important for veterinarians to understand that negative test results are not reported to the submitter via email or fax. They only report out positive test results or undetermined or unsatisfactory test results to the veterinarians or to the submitter. If you would like to have access to all of your test results as soon as they're completed, you need to create a LIMSnet account so that you can log in and have access to all of those test results. But like I said, rest assured, all unsatisfactory and positive test results are reported to the local health department and to our agency. So we reach out to the affected individuals in those situations to make sure that they don't need additional resources or assistance with their case. I want to finish up today by talking about the importance of animal vaccination in veterinary practice, which is what I think most of us in veterinary practice think about when we think about rabies. Veterinarians have played a crucial role in the control of rabies virus in the United States. At the beginning of the 20th century, the canine variant of rabies virus was present in the United States, and it was zoonotic in our dogs. There were usually around 10,000 dogs that were infected each year, and more than 100 human deaths each year as a result of rabies virus. And this graph that I have on the screen shows the number of domestic animal cases using the solid blue line, and the number of animal cases, is circled in red along the left side of the screen. The number of human cases is shown on the right side of the screen with the green circle and indicated on the graph with the dotted blue line. So, beginning in 1947, a requirement for the mass vaccination of dogs combined with leash control laws led to improved rabies control nationwide. And you can see that canine rabies and associated human rabies cases fell sharply after this. By the late 1960s, there were fewer than 500 rabid dogs and 3 human rabies cases reported annually. And the canine variant of rabies was completely eliminated from the United States in 2007. And what we now know is that vaccination of at least 70% of a canine population can reduce the risk of human cases significantly, almost to zero in most locations. So in Indiana, the vaccine must be administered by a licensed, accredited veterinarian or under the direct supervision of a licensed, accredited veterinarian. And this is different than a lot of the states that surround us. They don't have the same vaccine administration laws that we do here in Indiana. Veterinarians must administer the vaccine according to the label directions of the product that is being used. So remember I told you that we had those dogs that came into the US that were positive for rabies because they had received a partial dose. You want to make sure that you always administer a full 1 ml dose, regardless of the size or age of the animal that's being vaccinated. A lot of times people that have little tiny dogs want us to give a partial dose, and the answer needs to be no. The first dose of a vaccine an animal receives must be boosted within 1 year, regardless of the age of the animal when the first dose is given, and regardless of whether a 1 year or a 3-year product is used for the first dose. So the first time an animal gets a vaccine, it's only good for 1 year. And then at the time of the first booster vaccine, you can follow the label recommendations of whatever product you're using at that time. An animal is considered to be fully vaccinated and protected against rabies virus 28 days after the first dose is administered. And then with each subsequent booster vaccine that's given, the animal is considered to be immediately vaccinated. And what this means is that if the animal's overdue for vaccines, it can be given either a 1 year or a 3-year product at the time that it's boosted. There's no need to start over with a 1-year product after the initial dose of vaccine has been given. Now, some veterinarians may choose to recommend that a 1-year product be given if the animal is significantly overdue, but it's not required by Indiana law that you start over. There's no vaccination that's currently labeled for use in wild animals, and sometimes veterinarians may be asked to vaccinate captive wild animals with a rabies vaccine. We know that there are a lot of people out there who will have raccoons or foxes or skunk as pets, or potentially breeding animals. We also know that there are a lot of people that have wolves or coyotes or hybrids thereof that they may ask you to provide a rabies vaccine for. And I want you to know that there are no laws that prohibit the off-label use of rabies vaccine in these animals, but the owner and the veterinarian need to understand that the animal is not considered to be legally vaccinated in the state of Indiana. So in the event of a bite exposure situation, the animal is going to be treated as unvaccinated wildlife and may require humane euthanasia or testing. Whenever rabies is used in an off-label manner for wild animals, we strongly recommend that the veterinarian counsel the owner that the animal is not considered to be legally vaccinated. The vaccine could provide some protection, but in the event of a bite situation or an exposure situation, we don't consider that that animal has been vaccinated. And we want you to make sure that you're recording this conversation in the animal's medical record. Also, the veterinarian should not provide the owner with a vaccine certificate or a rabies tag for that animal, because those would imply that the animal had been legally vaccinated. We're frequently asked if Indiana allows for medical exemptions to the state rabies vaccine requirement, and unfortunately, the answer to this question is no. There is no provision written into Indiana law that allows us to provide an exemption. We recognize that there are medical conditions which could be exacerbated or made worse if you give a vaccination. And we strongly encourage the veterinarians to work with their clients to make the best decision for the overall health of the animal. With that being said, the owner has the right to decline the rabies vaccine. You have the right to recommend that that animal not be vaccinated. But I would just strongly recommend that that conversation be documented in the patient's medical record, because ultimately, if the animals are not up to date on their rabies vaccine, then they're going to be treated as unvaccinated or overdue in a human bite situation or in an exposure situation. And it's likely that they would then be required to be vaccinated. We also have a lot of requests to use vaccine titers in lieu of a current rabies vaccine. And I know that there are a lot of clinics that are currently using vaccination titers in lieu of the normal distemper combination vaccine or the feline panleukopenia vaccine combination. But unfortunately, there hasn't been sufficient research to establish a consistent titer value that we know provides protection in the face of a positive rabies challenge. So rabies titers are currently being used to prove that an animal has been vaccinated when moving animals internationally or in an exposure situation, or when the owner has an animal that's been exposed and they know that it's been vaccinated, but they don't have proof. And so they want to try to do the shorter 45-day post-exposure quarantine. But ultimately, we cannot use a titer to replace a current valid rabies vaccination according to Indiana law. And so with that, I would be happy to take any questions that you guys have. I just want to thank you all so much for spending your lunch with us and trying to learn a little bit more about rabies. On the screen, I have put my cell phone number or my email address that I'm happy to answer questions as you're moving through your regular practice lives. If you have something that comes up and you want to reach out, I'm happy to answer those questions. And I've also put the website, which is www.in.gov/rabies. There's a lot of useful information and statistics on that page, so I encourage you to look around.
Great. Thank you so much for this fantastic presentation. While Dr. Justice is taking a quick break for water, this is the ideal time to submit any comments or questions you have in the chat box. And please direct them to BOA or everyone in the chat section, and we will do our best to answer them. We have a number of questions already, Dr. Justice, so I think we'll just dive right in. Nicole asked, what is the next step if an owner does an at-home quarantine but does not come back to the hospital and goes MIA?
In that situation, I think just calling the owner to verify that the animal is still alive may be sufficient. If you have an individual in your staff who's been bitten and you don't have any way to verify that that animal survived that 10-day quarantine, then you could certainly reach out to the Indiana Department of Health and they can help you perform a risk assessment to see what steps need to be taken for the care of the individual that was bitten.
Great. Thank you. Kelly asked, I have had a human GP that did not know about filing bite reports. Is this something they are being educated about as well?
Honestly, I'm not sure. I'm not sure what is in their curriculum. I know that, it's written into law that when we're made aware, whether we're a human physician or whether we're a veterinarian, whenever we're made aware of a bite that has occurred, we are obligated to file that bite report. I think if there's ever a situation where you're in question of whether the bite report has been filed or not, you could certainly reach out to your local health department. And if they haven't received that report, then you could certainly do that.
Great, thank you. Our next question, Suzanne asked for some input. She said, several members of my staff have traveled to urgent care for dog and cat bites, and the physician asked for no information about the biter or owner of the pet. What is going on there? Is this likely how all dog bites are treated at the facility? Is that because the doctor assumed we would take care of paperwork because we're a vet clinic?
That's a really hard thing to
say what's going on in an individual facility. I think just reaching out to them and asking them if, if they have a protocol for what they're doing for bite report, or if there's a way to make sure that that's happening. Probably a direct communication would be best on that.
Great, thank you. We have a question wondering if the slides can be available. I know that we are going ahead and putting this on our YouTube website, or our YouTube channel, sorry. So we will discuss with Dr. Justice in the future if that's something that she is going to send out probably in like a PDF format. So
I would say we could probably create a PDF format of the slides that could be available. Would those be on the Rabies webpage, or would they be on our Indiana BOA page? Okay. Check back on, we could see if we could get those on both the BOA webpage and on the Rabies webpage. I think we could probably get a copy of the slides.
Great, thank you. So Brianna had asked, we had a situation where 2 cats had brought in a dead bat from outside through the doggy door, and then also had a dog that was found with a dead bat in the cage when the owner came home. Would you consider them to have been bitten and vaccinate and quarantine?
I think in that situation, if we have access to the bat, the best answer is to submit that bat for testing. And I often tell people, even if you're not sure if the quality of the bat is good, go ahead and submit it. The worst thing that happens is we get unsatisfactory results, and then we have to work to find the answer. But I feel like anytime an animal has had a bat in its mouth, there's the possibility that a bite could have occurred. And so I think we have to treat that as a potential exposure and then go forth with vaccination boosters and quarantine. But ultimately, I can't stress enough the importance of submitting those animals to the lab and getting test results. The testing is free at the laboratory. So the only cost that might need to be conveyed to the client would be the time for collecting the appropriate sample and then any shipping costs. So it's really important, I think, that we help facilitate that service for our clients so that they can get the answers they need.
Great, thank you. Sorry about the feedback. I'm turning off my mic. All right, next question we have from Nicole. How much of a risk is posed to staff when we get that seizing neurologic dog in and staff are exposed to saliva in the attempts to save the pet, then the pet ultimately dies, or the owners elect euthanasia? Should these patients be considered a risk and sent in for testing, or can it just be chalked up to seizure, heat stroke, etc.? Essentially, how do you rule out testing versus not testing in these emergency situations when with an unknown cause of why the pet is ADR?
So in my opinion, in those situations, if you have staff members that have had direct contact with saliva and you don't have an ultimate diagnosis of why that pet has died, and it is unable to be quarantined for the 10-day post-exposure period, those situations we need to submit that animal for testing. Because ultimately this disease is 100% fatal in humans and in animals without intervention. So I think we have to really take it seriously and make sure that we're protecting the humans involved in the exposure.
Great, thank you. Amy asked, is there access here for the prophylactic rabies vaccination for humans?
Yeah, so there, we do have access in the United States for the prophylactic pre-exposure vaccine, which most of us got prior to going to veterinary school. You can get those through some pharmacy services that have vaccines. They will sometimes have those pre-exposure vaccinations. A lot of times doctor's offices can order them in. So if you have staff that is interested in being vaccinated, I would say reach out to your health care provider or reach out to your local health department to see how that vaccine can be obtained.
Great, thank you. Related to that, do humans ever need to get a vaccine booster if they have been vaccinated?
Yeah, so this is a situation where, having an evaluation of what your titer is And then taking an exposure seriously will sometimes result in getting a post-exposure booster. And there are recommendations for that depending on the level of risk that was occurred, and what your current titer is at the time of the exposure.
Great, thank you. Next one from Kate, specifically to BOA. Which county health department should the bite be reported to? Where the bite occurred, or where the biting animal lives, or where the victim lives?
Typically, that's going to be the county where the bite occurred.
She says, also, if an owner informs us at the vet hospital of a bite that occurred more than 10 days ago, does it still need to be reported?
That I'm not 100% sure of. I would have to check with my counterparts at the Department of Health, but I don't think it would ever be wrong to go ahead and report that bite. For statistical reasons, for follow-up by the local health department nursing staff, if that needs to happen. I don't think you would ever be wrong in providing that information to your local health department.
Great, thank you. Mark is asking, is there any data on the effectiveness of post-exposure vaccination in dogs? In other words, if an unvaccinated animal was truly exposed to rabies, does vaccinating them within the 96-hour window effectively protect them from developing rabies infection?
There have been studies that have been done on that. I don't have access to that information now, but I can tell you anecdotally, we have a lot of animals that are exposed to known positive bats each and every year. And we always try to make sure that those animals receive their post-exposure vaccine within 96 hours and then follow them through their entire extended quarantine period. And in all of those situations, we've been very fortunate here in Indiana to not have those cases occur. So I think, not having that data exactly on top of my head, we can look anecdotally at the number of animals that are exposed nationwide and the fact that we don't typically have rabies cases in our domestic animal in the United States, and know that it works.
Thank you. All right, Kate asks, I know vaccinating during the quarantine period is not prohibited in animal-to-animal bites. What about in animal-human bites if you're not seeing the animal back?
So that's one of those situations where if you think that this is the only time you're ever going to have the opportunity to update that animal's vaccination and you want to take advantage of that, it's not prohibited. We have had some situations, though, where an animal was vaccinated at the beginning of the quarantine period and then had an anaphylactic reaction. And then there was a lot of concern, was this animal having an anaphylactic reaction to the vaccination, or was it showing signs of rabies? So I think that if you can avoid vaccinating the animal during that 10-day post-exposure bite period, that's the best thing to do. But I certainly wouldn't miss an opportunity to update a pet if you think this is going to be the only time you're ever going to see them.
Great, thank you. Shelby is wondering, if we have an owner refuse quarantine or submission, is there a resource we can contact to help us with getting the owner to become compliant or to be compliant?
This is one of those situations where we would encourage you to reach out to your local health department or your local animal control facility. They have the legislative authority to be able to enact those quarantines in those post-bite situations. So if you have an owner that just absolutely won't help you, then those are the situations where I would reach out to your local officials.
Okay, we have a question from Cheryl. What is the average cost for pre-exposure rabies shot?
Unfortunately, I don't have that information. I think it depends where you get the shots and whether or not it's covered by your insurance. I had to have the shots several years ago, which is the same injection, and it didn't end up costing me very much at all because it was covered by my insurance. But I think it really depends individually what kind of coverage you have and where you're getting that shot from.
They're wondering where they could get titers done in Indiana. A couple people have asked, how often should titers be checked? Human GP says just one time. And yeah, how often should rabies titers be checked in people? Okay, she is getting that information. We will go ahead and continue to the next question. Yeah, regarding certificates, give us a couple of weeks to generate certificates. They'll be sent via the email you use for registering. Again, if you signed on via your phone or if there are multiple individuals within a group that are all listening on the same sign in or login, please email us all of those individuals with their email addresses and their information so that we can get them a CE certificate as well. Lots of thank you for the help. Fantastic presentation, Dr. Justice. Thank you very much for all of your work. Let's see. We have. Okay.
I couldn't find it. So I can't find the information right now specifically. I know that within the last year, the CDC revised their recommendations on checking your titers after you've been vaccinated, how often you should be doing that. And it really depends on the classification of what your level of exposure is. We can try to find that information and link it onto our either our website, or maybe we can even send that link out when we send out the certificates. That be possible? Okay, we'll try to get that information for you, but you can also Google rabies vaccination titer recommendations from the CDC, and there's a chart. You did find it?
CDC recommends that people at risk for rabies receive a one-time antibody titer check between 1 to 3 years after receiving the 2-dose rabies vaccine series. The check is intended to ensure that people maintain long-term exposure to the vaccine. The minimum acceptable titer value is 0.5 IU. If the titer is below this value, CDC recommends receiving a booster dose of the vaccine.
Okay. So it sounds like 1 to 3 years after your shot, you should have a titer checked. And then if you are below the acceptable level, then you would get a booster. But like I said, there's a chart that talks about your level of risk on the CDC website. So I would encourage you to check there. Sorry, I don't have that information right now.
Thank you, Dr. Justice. It looks like everyone is very appreciative. We are at the top of the hour. I will leave another couple moments for questions. Any final questions? Just wanted to thank everyone for joining. You will be receiving continuing education credit for this webinar via email in the coming weeks. Again, if you called in, please email us to let you know, or sorry, to let us know that you joined. We will send you a certificate. Similarly, if there are multiple of you in a room listening to this webinar, please email us to let us know who all attended, and we will get those sent out. So not sure if we have any final questions. Denise just added the link to the CDC information on titers in the chat. So if you have any questions about that, that's.
Thank you for doing that. Appreciate it.
Thank you very much for adding that. Dr. Blau mentioned Kansas State is the easiest to work with on checking titers in my experience. I don't have experience with Kansas State, but thank you for thank you for letting us know. Appreciate that. Doesn't seem like we have any additional questions. So yeah, with that, thank you all for joining. We really appreciate it. And again, if you have any other questions, Dr. Justice provided her information, and we will, with that, go ahead and sign off. Again, Dr. Blau, thank you for, she has posted the Kansas State information. We really appreciate you sharing that with us. So thank you very much for joining us today, and I hope you have a wonderful rest of your day.